The aero factor in gluteoplasty and Brazilian butt lift. The gluteal region has become a rising area of interest in plastic surgery in recent years, as reflected in body contouring surgery trends. In this study, the authors explain what the aero effect consists of and how to highlight it during a Brazilian butt lift or a gluteal liposculpture. Although several studies have already been carried out regarding the aesthetics of the female gluteal region, 3. For this dizzying increase in activity perhaps prompts the development of further analyses. The shape, volume, and projection of the buttocks, the dimples of Venus, the infragluteal sulcus, and the erector spinae muscles are all factors that harmoniously contribute to the delineation of aesthetically pleasing buttocks. 69. With this in mind, what we call the aero factor can help to visualize a possible pleasing outcome if we look at the back of a female figure considered pleasant, by stylizing the main morphological constituents, upper contour of the buttocks, dimples of Venus and spinal column. The figure that can be abstracted is surprisingly similar to that of an arrow, pointing toward the genital area. It follows that to recreate or enhance this aero effect, the surgeon must follow determined, precise procedures. Liposuction of the sacral triangle, fat grafting of the upper gluteal quadrants, liposuction of the dimples of Venus and of the midline superficially to the spinal column, and fat grafting of the erector spinae muscles. Slides 5 yellow marker minus signs, liposuction, blue marker, plus signs, lipofilling. This last aspect, sometimes overlooked, is very important in our opinion for the overall aesthetics of the female back. 10, figure 3. The dimples of Venus, fossae lumbales laterals, can be recreated by performing a small superficial liposuction near the posterior-superior iliac spine. Depending on the physical constitution of the patient, in some cases, it may be preferable to try to highlight a smaller arrow. Slide 6 here, the arrow cusp is determined by an equilateral triangle, with a lower vertex, oriented to indicate the upper apex of the intergluteal sulcus, with the two oblique sides, of a few centimeters, outlined by the medial convexities of the two superomedial gluteal quadrants, figure 4. In these cases, surgery may be limited to liposuction of the internal sacral triangle with simultaneous fat grafting of the corresponding suprainternal gluteal arches. In conclusion, we hope that these minimal considerations might be of some help in the sometimes difficult process of planning cosmetic procedures of the gluteal region. The aero